Hi, my name is Natalia Cantos, and I will talk about evaluation of diabetes in self-management of the program for all people in Ecuador. Definition: Diabetes is a chronic complex condition requiring some knowledge and self-management skills to optimize glycemic control and health outcomes. Dietary intake and physical activity are key diabetes self-management. Older adults with diabetes are at a higher risk for both acute and chronic and microvascular complications from the disease, including major lower extremity amputations, visual impairments, and renal disease, compared to any other age group. Patients who are over 75 years old are more likely to develop complications, have a higher rate of death from hyperglycemic crisis, and have an increased rate of emergency department visits for hyperglycemia compared to those who are younger.
So being older and heavier and more sedentary makes our bodies resistant to insulin.
And that's when we become susceptible to diabetes and its complications. Philip says that may include eye disease, kidney disease, nerve disease, heart attacks, and strokes. As baby boomers enter their golden years, there's growing concern about the debilitating disease. According to the American Diabetes Association, 1 out of 4 seniors over the age of 65 has diabetes. And Dr. Phillips explains that diabetes tends to get worse the longer you've had it.
So if you developed diabetes in your 50s or 60s and you're now 75 and you've had the disease for 10 or 20 years, by and large it means that your insulin producing cells aren't working as well.
An effective way to treat diabetes and manage its effects is to eat healthy foods and maintain the proper weight.
People who are older find that while their metabolism isn't.
Application in nutrition. Nutrition is cornerstone of diabetes management. Decisions related to food intake are considered as one of the most challenging aspects of diabetes control. Dietary accommodation for diabetes implies an individualized approach to optimize food and nutrition intake. The guidelines focus on eating partners, portion control, and carbohydrate quality, quantity, and distribution to optimize glycemic control in addition to weight status, blood pressure, and plasma lipid profile.
If you have diabetes, you need to abstain from all carbohydrates. True or false? False. In fact, carbohydrates account for up to half the body's energy needs. Instead of eating simple carbohydrates, which causes surge in blood sugar levels, eat more starch-based carbohydrates. Eat fruits in moderation as they contain sugar. Consume sufficient fiber to slow down your body's carbohydrate absorption. Animal protein is carbohydrate-free, but plant-based proteins and dairy products contain carbohydrates. Strive to maintain a healthy BMI. The heavier you weigh, the higher your diabetes risk. Consult a dietitian to better understand your nutritional requirements. For more health tips and videos.
Pros and cons. Pros. Feeling of belonging to a group of peers is transformed into motivator for adherence to treatment. The educational strategy combined with clinical treatment provides the necessary incentive to measure change in the patient lifestyle. Cons. The diagnosis of diabetes is very stressful for patients. The initial shock and fear of the new diagnostic is a major barrier to understanding the indication given by the doctor. Apply in Ecuador. The Ecuadorian Constitution protects and implements the right to health. The National Plan for Good Living was developed as a strategy to transform the structure of healthcare and therefore improve the quality of life of Ecuadorian population. To this end, the Comprehensive Healthcare Model (MAIS) has gradually been implemented in health centers across the country with a focus on chronic disease. Conclusion: Because of the dramatic increase for diabetes in the elderly population may ultimately prove to be the disease with the highest death in the country. Fortunately, our increased understanding of the pathogenesis and treatment of the illness should allow us to improve the outcome of the large number of elderly patients that will be afflicted with this illness.